Welcome to another episode of Beneath the Surface Gems. We are continuing our conversation on COVID-19 and mental health with clinical psychologist Dr. Aubrey Franklin. This week, we highlight our body's physiological response to stress. Let's dive in.
I want to allow you to talk to us about our physiological response to stress. How does our body respond?
Now, there is and I remember us having this class, health psychology, right? And
Yes.
health psychology deals with this word that's always hard to pronounce, but it's very important. Psychoneuroimmunology, PNR. And basically, that just lets us understand that there's a link between our psychology, our neurons in our minds, in our brain, and also our immune system, our bodies, right? Our body has an immune system. In fact, just to help individuals out, AIDS stands for autoimmunodeficiency syndrome. So nobody dies of AIDS. They die because their immune system has been compromised, and anything can kill them now. Pneumonia.
That's right.
That's what's happening with COVID-19. If you already have a lower immune system, then that's what's really gonna make it happen. If your immune system is already functioning normally, then yes, you have to still have those precautions, of course, but it's not gonna affect you as much as somebody who has a compromised immune system. So this is stress. If we were to equate our immune system to our physiological response to stresses, stress can come in many forms, like we said. It can become in our perception, our mind. It could come physical, like a disease, or it could be just something that actually happens to our body. What is a great, powerful statement and knowledge to know is that we have an immune system. We have a ADT system, security system, if you will, when it comes to stress. When stress comes knocking at our door, our immune system immediately goes into action. We know this as the fight or flight scenario, right?
Mm-hmm.
Now, what happens in the fight or flight response is hormones increase. Now, hormones also are what help us grow, hormones that help facial hair grow, our eyes dilate. We have a hormonal system, an endocrine system that also helps with our immune system in our bodies. Now, when it comes to stress specifically, two hormones are activated. Cortisol, which I think if you know a little bit about cortisol, cortisol is something that increases when we're under duress, right? So when we're, and what cortisol does, it increases our heart rate, it dilates our pupils, it basically makes us ready to fight, right? It's like, oh, I'm ready, okay. Because normally we're gonna need that in order to work things out. But the second hormone, which goes overlooked a lot, is this hormone called oxytocin. Now, mothers know, breastfeeding mothers know this hormone because this is what hormone is given to help bonding happen between you and your baby. Oxytocin is also increased when you're in love. It's the love hormone. There is a love hormone, excuse me. So what we need to also focus on is not just cortisol, the fight or flight, but oxytocin, which is also a tend or befriend response. And I would say exclusively for this pandemic, we need to focus more on that oxytocin, that bonding.